Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about physiology of second stage of labor. Let's get started. Now we will see about the definition of the second stage of labor. This stage of labor begins when the cervix is fully dilated, that is, opened up to about 10 centimeters, which allows the baby to pass through the birth canal. At this point, the body is completely ready for delivery, and the mother usually starts feeling a strong urge to push because the baby is moving downward. The second stage continues with strong uterine contractions and bearing down efforts, and it finally ends with the complete expulsion or birth of the baby. Now let us talk about the duration of the second stage of labor. The time taken in this stage is not the same for all women and mainly depends on whether it is the first pregnancy or not. In a prima gravida, meaning a woman who is delivering for the first time, the second stage usually lasts about 1 to 2 hours. In a multigravida, that is, a woman who has delivered before, the muscles are already more relaxed. So the second stage is much shorter and usually lasts around 30 minutes to 1 hour. Now let us understand the first major physiological event in the second stage of labor, which is uterine contractions. During this stage, the contractions become much stronger, last for a longer time, and are more forceful because their main job now is to push the baby out. These contractions usually come every 2 to 3 minutes, and each one lasts for about 60 to 90 seconds. The upper part of the uterus, called the fundus, contracts very powerfully and pushes the baby downward into the birth canal. At the same time, the upper uterine segment becomes thick and strong, while the lower uterine segment stretches and becomes thinner to allow the baby to pass through smoothly. Now let us understand the function of uterine contractions in a simple way. During the second stage of labor, uterine contractions play a very important role. These strong contractions help to push the baby downward from the uterus into the birth canal, which we call fetal descent. As the baby moves down, the contractions also help the baby to turn and adjust its position so that it can pass easily through the pelvis. This rotation is necessary for the head and shoulders to come out smoothly. Finally, these same contractions help in the complete expulsion of the fetus, meaning they assist in the actual birth of the baby. So in short, uterine contractions help the baby come down, turn properly, and finally be delivered safely. Hello students. Now let us understand bearing down efforts, which is also called maternal pushing, in a very simple way. During the second stage of labor, as the baby's head moves down, it starts pressing on the pelvic floor, the rectum, and the stretch receptors present in that area. Because of this pressure, the mother naturally feels a strong urge to push, very similar to the feeling of passing stool. This pushing is mostly involuntary and happens along with uterine contractions. When the mother pushes, the abdominal muscles and diaphragm contract, which increases the pressure inside the abdomen. This increased intra-abdominal pressure works together with the uterine contractions and helps the baby to move further down, rotate properly, and finally come out through the birth canal. During the second stage of labor, as the baby's head moves down, it starts pressing on the pelvic floor, the rectum, and the stretch receptors present in that area. Because of this pressure, the mother feels a strong, automatic, and involuntary urge to push, very similar to the feeling of passing stools. This pushing is not forced. It happens naturally as a reflex. When the mother bears down, there is a coordinated action of different muscles. The diaphragm moves downward. The abdominal muscles contract strongly, and the pelvic floor muscles work together. All these actions increase the pressure inside the abdomen, which helps to push the baby further down the birth canal. These bearing down efforts work along with uterine contractions, making labor more effective and finally helping in the smooth expulsion of the baby. Now let us understand the fetal movements, also called the cardinal movements of labor, in a very simple way. During the second stage of labor, the baby has to adjust itself to pass through the birth canal, and it does this by a series of natural movements. First is descent, where the baby's head gradually moves down into the pelvis with the help of uterine contractions and maternal pushing. As the baby moves down, flexion occurs, meaning the chin bends forward and touches the chest, so that the smallest part of the head comes out first. Next comes internal rotation, where the back of the baby's head, called the occiput, turns towards the front to align with the shape of the mother's pelvis. These movements are very important because they help the baby pass smoothly through the birth canal and prepare for a safe delivery. Next comes extension of fetal head. As the baby's head comes down and reaches the vaginal opening, it cannot come out in a bent position. So, the head slowly bends backward or extends to pass under the pubic bone. This movement helps the head to be delivered safely. Next is restitution. After the head is born, it turns slightly to one side. This turning helps the head come back into line with the shoulders, which are still inside the birth canal. This is a natural adjustment made by the baby. Then comes external rotation. After restitution, the baby's shoulders rotate inside the pelvis to fit into the widest part of the birth canal. At the same time, the head also turns externally to show this movement. This helps the shoulders to be delivered one after the other. Finally is expulsion. Once the shoulders are delivered, the rest of the baby's body comes out easily and smoothly. This marks the complete delivery of the baby and the end of the second stage of labor. Now we will discuss the changes that happen in the pelvic floor during the second stage of labor. As the baby moves down through the birth canal, the pelvic floor muscles begin to stretch to allow space for the baby. These muscles become thinner and are pushed downward and forward because of the pressure of the baby's head. This stretching is very important as it helps the baby to move in the correct direction for birth. The levator ani muscles, which are part of the pelvic floor, act like a guide and help direct the baby's head forward towards the vaginal opening. As labor progresses, the perineum, which is the area between the vagina and the anus, starts bulging gradually. A very important clinical sign seen at this stage is crowning. Crowning means the largest part of the baby's head can be seen at the vaginal opening, and it does not slip back in between contractions, indicating that delivery is about to occur. During the second stage of labor, the baby's head has to pass through the mother's pelvis, which is a tight space. To make this possible, the bones of the baby's skull are designed in such a way that they can slightly overlap each other. This overlapping mainly happens along the sagittal suture and at the fontanelles. Because of this flexibility, the baby's head can change its shape a little and adjust to the size and shape of the pelvis. This process is called moulding. It is completely normal and temporary, and after birth, the baby's head gradually returns to its normal shape on its own. Now let us understand the hormonal influence during the second stage of labor in a simple way. During this stage, certain hormones play a very important role in helping labor progress smoothly. Oxytocin is the main hormone responsible for making uterine contractions stronger and more frequent, which helps the baby move down. Prostaglandins also support labor by increasing the ability of the uterus to contract effectively. At the same time, endorphins are released in the mother's body, and these act as natural pain relievers, helping her cope with labor pain. Towards the late part of the second stage, catecholamines are released, which make the mother more alert and help improve her pushing efforts. All these hormones work together to support safe and effective delivery of the baby. Now, let us look at the maternal physiological changes that occurred during the second stage of labor. During strong uterine contractions, the mother's heart rate and blood pressure increase because the body is working very hard. At the same time, the body uses more oxygen to meet the increased energy needs. While pushing, some mothers may naturally hold their breath for a short time, which is called the Valsalva maneuver. Because of continuous contractions and active pushing, the mother may feel tired, and there is an overall increase in fatigue and metabolic demand. These changes are normal and help the body support the process of childbirth. Now we will see about the fetal physiological response during the second stage of labor. During each uterine contraction, there is a temporary reduction in the amount of oxygen reaching the baby, because blood flow through the placenta is slightly reduced. This is a normal and expected change. As a response, the baby's heart rate may show some variations during contractions, but it usually returns to normal in between contractions. This recovery is a good sign and shows that the baby is coping well with labor. The placenta acts as a strong reserve and continues to supply enough oxygen and nutrients, helping to maintain the baby's well-being throughout the second stage of labor. The second stage comes to an end when the baby is completely delivered from the mother's body. Immediately after birth, the baby usually cries, which is a good sign showing that breathing has started. The umbilical cord can still be felt pulsating for a short time, indicating continued blood flow from the placenta to the baby. Once the baby is born, the second stage of labor is considered complete, and the third stage of labor begins, during which the placenta separates and is delivered. That brings us to the end of today's session on the second stage of labor. I hope this explanation helped you understand the topic clearly and in a simple way. Thank you so much for listening patiently and learning along with me. If you found this session useful, don't forget to like, comment, share it with your friends, and subscribe for more easy and exam-oriented nursing concepts. Thanks for watching and happy learning.